This week, we saw headlines about women facing a breast cancer diagnosis while they're still in their reproductive years building their families. For example, Olivia Munn just had a second child via surrogacy after being treated for breast cancer. I'm Dr. Lucky Seacon, a double board certified OBGYN and REI, and I've helped a lot of women navigate their family building plans after being treated for breast cancer. One thing I can tell you is that no two cases are alike. This is a prime example of where you need to treat every patient case individually, and there really is no rule book when it comes to whether someone can carry on their own or whether they need to have a gestational carrier or a surrogate. It's a complicated topic, so I teamed up with a board-certified medical oncologist who specializes in breast and GYN cancers, Dr. Teplinski.
Let's talk about pregnancy after breast cancer. I'm Dr. Eleanor Teplinski. I'm a board-certified medical oncologist specializing in the treatment of breast and gynecologic cancer. Now, pregnancy after breast cancer is a complicated topic. There are many factors that go into making the decision of whether someone is able to carry a pregnancy on their own or if they need to use a surrogate or a gestational carrier. Before we go into that, though, I really want to stress that one of the most important parts is that anyone of childbearing age should have fertility counseling with a reproductive endocrinologist prior to starting breast cancer treatment. Sometimes patients say to me, I'm not sure if I'd want to have children in the future, and I still really urge them to at least go for the consultation and get all of their information. Now, in terms of after breast cancer treatment, there are many factors that go into that decision: surrogate pregnancy or being able to carry on your own. Some of the factors that drive this decision include the type and stage of breast cancer, the treatment that someone has had in the past and may still be on, because that really impacts the recommendations, and the timing. It really is not a one-size-fits-all approach, and so there aren't any really concrete guidelines about carrying a pregnancy on your own versus a surrogate carrier, but it's really a discussion that a patient is going to make with their healthcare team. I will say that genetics also plays a role into that, because if someone has a genetic mutation like the BRCA mutation that increases their risk for ovarian cancer, they may also be advised, depending on their age, to have a risk-reducing surgery. So that certainly may impact the treatment as well. And ultimately, it is a patient's goals and wishes and desires, and that plays a big part into those decisions as well. Let me know your questions. I'm happy to answer them.